WMNF Tampa.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Good morning to you. Yes, you, my dear listener, and welcome to the Healthy Steps radio show here on WMNF Tampa, the best darn station in the nation and the only community-supported radio station that you can stream by going to WMNF.org. Today is AMA Monday, the Ask Me Anything component of the Healthy Steps radio show. So yes, you get to ride the shotgun in this Radioland vehicle, and you get to pick the direction in which we go. If you have any medical questions or concerns, give us a call at 813-239-9663. Irene has come in today to take your call, and I do believe that Irene gets a smile bigger than the state of Texas every time she answers the phone. So again, that number to call is 813-239-9663. You can also send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Harvey. I already feel like I've said too much, so let me step humbly out of the way. What have you got for us today, Dr. Fred?
Happy Monday, Bill, and all my Healthy Steps listeners.
And back to you there, Doctor. Welcome to the Healthy Steps show today.
Thank you. So, what a beautiful day in Florida. And a beautiful day all around. You just have to look for the beauty. Sometimes it's tough to find, but there's always something you can find that's going to be beautiful in your life. And, so many people are looking for like this extra bit of beauty. The social media influencer world of looking perfect with photoshopping, et cetera, is really driving people to look for ways to change themselves when they don't really even need to. The thing that I'm referring to is I read an article this weekend in Scientific American called "What Most Men Don't Know About the Risks of Testosterone Therapy." The article starts off with a couple of stories of some men who went looking for something different. He saw the social media influencers doing certain things, and he wanted to enhance his health. And another guy named Rahim, I think these are actually fake names, he went to a walk-in with no real problems. Testosterone therapy is so readily available that actually it's been looked at. There's a Dr. Dubin who did a study a couple of years ago, and I think it was in 2022, and what he found out was that the direct-to-consumer online platforms are prescribing testosterone without really any kind of methodology. When a functional medicine doctor looks at someone who has complaints, possibly fatigue, lower skeletal muscle mass, obesity, fatigue, maybe low mood. These things might indicate a hormone challenge. But what this Dr. Dubin found was that most of these online direct-to-consumer platforms don't really do any kind of real evaluation. In fact, I think out of 7 platforms they evaluated, only let's see, not one of them measured testosterone twice. Only one of them used the standard 300 nanogram per deciliter as the cutoff for low testosterone. They would tell someone who has and the range is from 300 to 1100 or something like that, and they would tell people who have a 600 or 700 testosterone level that they still need testosterone. Basically, the direct-to-consumer platforms are not following any of the European or American guidelines from endocrinology and urology on how to actually, prescribe testosterone replacement therapy. And so the example of Rahim, he went to a walk-in, a testosterone walk-in, got no testing, zero. He got an injection that day. On subsequent visits, they kept pushing more and more, even though he got adverse consequences. They treated the adverse consequences with more medications to help prevent the effects of excessive testosterone therapy, and instead of taking the testosterone away that he didn't need. And he got adverse consequences, didn't get any help. And another guy, the other one I talked about, Bob, he had a normal testosterone. Both of them, actually, the one we didn't know if he had a normal testosterone. The other one had a normal T. They prescribed testosterone anyway. Of course, it didn't help, because if you don't have a problem, you don't have a problem. But the HIM study, I think it was done in 1999 or something like that, years ago. Maybe it was 2009. What they showed in the HIM study was that it's health in men, and men who have poor health have low testosterone. Low testosterone is associated with obesity, diabetes, medical problems, hypertension. Sleep apnea is one of the biggest ones. People who have sleep apnea shouldn't treat sleep apnea with testosterone. They should treat the sleep apnea, and then the testosterone will probably get better. But I think most doctors that prescribe testosterone actually talk about the potential adverse consequences of infertility. Yeah, testosterone causes male infertility because it actually slows down the production of the sperm when you have too much of it, and it shrinks your testicles. So then you don't make as much testosterone if you want to try and come off of the exogenous hormone replacement therapy. This is a real serious complication. I've actually helped men get off of inappropriate testosterone therapy, but you have to coach and coax the testicles to work again using other hormones to signal that they should turn back on. Another thing that I've seen in people that don't listen to guidelines when they're using the testosterone therapy and refusing to treat other conditions. I had one patient who had sleep apnea. He refused to treat the sleep apnea. It causes erythrocytosis, too many red blood cells, because you need more red blood cells to carry around the limited oxygen that's occurring because of the sleep apnea. Well, sleep apnea causes low testosterone. And so treating his low testosterone, which was caused by sleep apnea, with more testosterone just increased the erythrocytosis. The problem with that is when your blood's really thick like that, it can actually cause strokes and other clotting problems. And so you don't really want erythrocytosis. That's a bad complication. Acne is another one. Breast enlargement with tenderness. Men grow breasts because the excess testosterone converts to estrogen, and estrogen causes breast tissue to grow. And fluid retention, swelling at the ankles. The capillaries leak because they're sick, they're overstressed. But a lot of people have pushed back on using hormone therapy in the endocrine community because they thought that there was a lot of potential risk. They thought that it would cause prostate cancer, but there was a study called the TRAVERSE study, TRAVERSE. I think it was about 4 years ago. In any event, they looked at thousands of men, and they found there was no increase. That's thousands of men taking testosterone therapy. No increase in prostate cancer, no increase in cardiovascular death, stroke, or heart attack. And so it's independent of that. But it does actually increase problems, like I said, infertility, shrinking testicles. In trans men using testosterone therapy, they get actually an increase in fractures. And some other things. It's really interesting. It causes in the female genetic body to use testosterone in the doses for men. It actually changes their immune system more to a male immune system too. It's really amazing. So the there's another problem with doing the testosterone therapy is that they're not sure which to measure. There's correlations with low testosterone, but there's also correlations with low free testosterone. So is it better to measure testosterone, free testosterone, both? Which one to use as the main guideline? That makes it a little murky, but it's not too hard to figure that one out if you're actually doing the testing. But most of these centers never do any further testing. And in the Traverse study, they found that there was benefit. People did get better if they had actual low testosterone, below 300, below 250. But there was no benefit in people who had mild cognitive changes, mild mood problems. But when they had severe depression, yes, depressed mood did get better. Brain fog didn't, though. And so a new wrench to throw into the whole process is we now have these peptides that are treating people and helping people get better. And so we know that obesity and diabetes is related to low testosterone. It actually seems to be sort of causative, but low T can actually make those two things worse also. So is it better to use Ozempic or testosterone to treat the problem? There's the question. That gets into a little bit of an issue. So when we look at that and consider it, it's like there are so many physiologic things going on that it gets a little confusing. I can go into a little bit more detail, but I just want to remind people that this is a call-in interactive show, the Healthy Steps Show.
That is so true, and if we don't have callers, we don't have the interaction. Just you and me, and that's not quite good enough for me. You are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, and as we've been alluding to, you are invited to participate in this show. Just give us a call at 813-239-9663. Again, that number to call is 813-239-9663, or continue to send your emails to dj@wmnf.org, and you can also text us at 813-433-0885. Back to you there, Doctor.
The issue of replacing hormones is very complex. It seems straightforward. You have a low testosterone, you give the testosterone, but there are so many interesting things that happen in your physiology with it. So what causes hypogonadism? I was mentioning there are all these medical issues that can contribute. And a study was done looking at testosterone replacement in men with hypogonadism. And let's see, there were 45 to 80 years of age, and everyone had testosterone on two different occasions. The levels were less than 300 nanogram per deciliter, or 10.4 nanomoles per liter, which is the European way of describing it. And these were done on separate days so that we know that there's a consistency here. And then when they were found to have that, there were 5,200 men, 2,600 in testosterone, 2,600 in placebo. And after 3.19 years, a clinical fracture had occurred in 91 participants in the testosterone group and 64 participants in the placebo group. So we know that testosterone helps to build lean body mass, but among middle-aged and older men with hypogonadism, testosterone treatment did not result in a lower incidence of clinical fracture than placebo. In fact, it was associated with a numerically higher amount of fractures in these men. And the hazard ratio is like 1.43. That's almost 1.5 times higher likely hazard for getting a fracture than if you don't take the testosterone. So what was missed here? We don't know, because they don't present that in this trial. It was a large trial, so it was actually pretty well, well, it corresponds well numerically. There are enough people that the study actually can provide data that makes sense. If it's a study of only 10 people, you have to wonder if it's really, a real answer, because it's not a big enough population. You can't get statistical significance out of it. But the overall results here are very interesting. How they ended up with more fractures is not explained by the researchers, but they do discuss it to some extent, and they talk about lots of different things. But you know what? We can talk about all kinds of things here too, because I think we have some callers on the line.
Oh, we've got a slew of them. I've got Tom and Sarah and Sheila and somebody else just calling on in. So let's go to Tom. Good morning to you, Tom.
Good morning.
Hi, Tom.
Hey. First of all, I like to say that I think that all health starts with what we eat. And on that, I've been working on the best healthy snacks that I can come up with, and I so far I like walnuts a lot, and walnuts with roasted pecans, roasted and salted pecans are real good with some peanuts in there. Just to me, it's delicious.
Nuts are an excellent snack. Yes, they actually reduce your risk of colon cancer.
Right. Yeah, there's so many benefits, and there's a bunch of different kinds of nuts. Now that the drought's kind of over in California, I started eating almonds again. And, oh, man, it's so good. But my question to you is, I've just been thrilled with these avocado potato chips. I tried the olive oil ones, and they were okay, but they, after like a week, if you don't eat them right away, and even if you leave them sealed in the bag, after a month sealed in the bag, that olive oil it seems to deteriorate. The taste just goes.
Well, you shouldn't be. Nobody should really be using olive oil for deep frying, for the most part, because you heat the oil up too high, and then it actually accelerates the oxidation and acidification of the oil. Not a good oil to fry with.
Right. Exactly. And what a waste of olive oil.
Yes, indeed.
But the avocado oil has that high flash point, and I'm telling you, they are really good. And there's some, I've just been impressed. There's some brands out there. They have all natural. I'm looking at some of these flavored chips. They're flavoring them with garlic powder and beet powder and peppers and the only preservatives on some of them are citric acid and and lactic acid.
Yeah, they really are. A bunch of companies are stepping up and getting rid of the artificial ingredients.
Yeah. So, what's your? Have you done any kind of a deep dive on the avocado oil?
Avocado oil is a great oil. I see no reason to not use it. You want to avoid canola oil because canola rapeseed oil, it's a oil. The molecule is a different length than the fat in our body. We have 18 to 22 carbon length fats. It's 24. And so it actually is too long for our cells. It's not a good oil. It's good for diesel fuel. That's what actually the diesel engine was designed to burn, rapeseed oil. But we are being snookered and we burn, petro in it. But yeah, we shouldn't be really eating canola. It's definitely made for industrial use.
Yes, and I've been hearing that the potatoes are among the healthier of the snacks. They are a slow burn carbohydrate. Do you have any opinion on the potato?
Yeah, avoid any potato that is not labeled organic. Potatoes have the highest amount of fungicide per gram of flesh to keep the little black spots out of the French fries and the potato chips. So if it doesn't say organic, it's likely you're eating a neurotoxic fungicide on your little potato chip.
Oh man. Okay.
Only organic potatoes, definitely.
Yeah. Yeah. Well, all right. I'll be looking. I'll be searching for that.
Yes.
And then they got the palm oil, and I hear that the cottonseed oil is coming back. You got any ideas on those?
Cottonseed oil is likely highly toxic because they spray a lot of chemicals on cotton to keep the insects from eating it, and the other one is what was the other oil you said?
Palm.
Palm. Oh, palm. Yeah, no, they're raping the rainforests in Indonesia to grow palm. They're cutting down pristine rainforests and putting up these crappy palm oil plantations against Indonesia's law, but they're doing it anyway.
Right. I'm with you on that. And in conclusion, I've been using. They've got this new THC gel topical. Yes. It's not CBD, although I think the CBD is pretty good too. But I've been using it on some of my, I got a torn cartilage and other problems, and I've been finding a real good effect on THC gel. I thought I would throw that out there.
So you get that from a dispensary?
I sure do. I have a prescription, and
yeah.
They had this waxy stuff before, but the gel that they've come out with now, it goes in faster. It's not sticky. It dries. And,
excellent.
And man, I'm telling you what, the swelling goes down, the pain goes down, and I cannot recommend it enough.
Wonderful. There's all kinds of solutions out there, and that is one of them. Thanks, Tom. Have a great week.
Thank you for everything. Good day. Bye-bye.
Thank you there, Tom. And not to confuse things, I've had another Tom waiting patiently. Good morning, Tom.
Hello, Dr.
Hey
Harvey.
there. Yes, indeed.
Yes, I want to thank you, first of all, for your show. It is just incredible. I love it. And my question to you is, I have just recently been diagnosed with prostate cancer. I had a biopsy done, and I just it's in a very early stages.
So did they tell you what your scoring is?
Yes, it was a Gleason 6.
Okay.
I had gone from a 4.3 to a 4.6 PSA, and so I did an MRI, and then that's when they noticed that the left side of the prostate was slightly, swollen or a little bit. So they said, let's do a biopsy. And so that being said, I said, okay, so I'd had the biopsy, and I wish I had I got a book that researched a lot of this stuff, and I find out with the needle biopsies that there's a thing called needle tracking, and they said that where they go into an area and if they find a cancerous area, that they go into other areas of the prostate taking these samples, which they took 13 samples for me, but they said that could transfer cancerous cells to other parts of the prostate, but wouldn't show up for like 18 months later.
Right.
And I just, right now the doctor has scheduled me for a PET scan, which comes up in about another couple of weeks. To see if any cancer is spread throughout my body.
Sure.
And I'm kind of not too worried about this because he said, it's such an early stage, but I've changed my habits as far as, I cut out coffee, I've cut out, I don't drink, I've cut out the cannabis, I've cut out sugar, I've cut out, I'm just going with leafy greens. And
why did you cut out the cannabis?
Excuse me?
Why did you cut out the cannabis?
Well, one of my neighbors had told me that I probably ought to because he heard a fellow who had testicular cancer the doctor told him to leave the cannabis alone. So I thought, well,
the doctor is a little confused. There's a lot of literature about cannabis actually slowing it down. In fact, there's a thing called RSO, Robert Simpson oil, but it's a highly concentrated cannabis oil that people have used to support cancer for years. But here's the deal. You have a Gleason 6 prostate cancer. Gleason 6 is one that some urologists would call low grade enough to be in a place of watchful waiting. But I don't do watchful waiting. I think that is waiting for disaster,
right,
because you can intervene in the meantime. And you've done some things. You've changed your diet and things like that. But there are three things to consider here. One is the interventions that you have at hand to treat it now that don't restrict you from getting interventions later. So one of them is called cryotherapy. It's a relatively non-invasive surgery where they freeze the tumors and you pee them out. The next one is HIFU, high intensity focused ultrasound. That uses ultrasound to dissolve the tumors and then you pee them out. And then finally, there are the other surgical, radical prostatectomies, seeds of radiation or external beam radiation. But all those last three can't be actually repeated. If you miss it, if you take the prostate out and you're impotent and you are incontinent of urine, but you still have prostate cancer outside the system, then you've lost. If you use the cryo, you can go back and do it again. If you use the HIFU, you can go back and do it again. You can do cryo after the HIFU. You can actually do radiation after that. And so there's so many different things to do it in sequence. I would not allow anything very aggressive to begin with as far as radical prostatectomies and radiations, but I would consider talking to a urologist who uses cryo or HIFU as a first intervention and get it treated.
Oh, okay. I also had read about a one called the ultrasound sonogram. I guess this one fella out in Arizona practices it, and it's a color Doppler ultrasound.
Yeah, that has nothing to do with what we're talking about. So that's just a picture. I'm talking about using ultrasound to melt your prostate. There are doctors who do that. There are doctors in Sarasota who do it. I'm sure there's somebody in Tampa who does it. I'm not sure where you are, but there are doctors all over the place that they're using HIFU, HIFU, high intensity focused ultrasound to kill the cancer, or cryo surgery. And those two are the first interventions because you can repeat them and they're very effective. But you had to get the biopsy for anyone to do any intervention, even though there may be some small risk of having a tumor move along the track. No one in America will treat you for prostate cancer unless you have a biopsy.
That's what I read. Yes. What was that one you said? It was HIFU or something? HIFU, high intensity focused ultrasound. That one and cryosurgery are the two things that I would consider on me to do first because I don't want radiation in my body and I don't want my prostate cut out. That's how I feel. Yes. Okay. So HIFU and the cryo, that's the freezing part?
Yes.
I see. Okay. Does that incorporate using a laser at all?
No, that uses a freezing device. The laser is only used for the prostate enlargement to help you open up the urinary tract.
I see. Okay. I had heard also I'm taking dandelion tea, and I'm going to be getting the roots and stuff, but I've heard that kills all kinds of cancer as well. Is that, would you recommend something like that?
Dandelion is a really nice liver support.
Yes.
Dandelion tea is a great support for your liver, but it's nothing that is going to be treating your cancer. One thing that I find highly effective for disrupting cancer metabolism is a combination called cytokine balance from a company called Zymogen. It's got green tea extract, curcumin from turmeric. It's got broccoli extract called sulforaphane, and it's got resveratrol in it. And those four things disrupt cancers. They don't treat them, they disrupt them.
I see. Okay.
One of those days is a good thing to take, or take one of each of the other four supplements.
I see. Okay.
Good luck, Tom.
with the dandelion, I heard that it could actually, they're having results curing leukemia, a certain type of leukemia, and other types of cancers. And
I've not heard that. I've never heard of dandelion being a cure for any type of cancer. In fact, I don't use the word cure at all in treatment of things like that.
Oh, I see. Okay. I see. Well, okay.
Good luck with your search for help on this prostate. I think you'll find it locally. There's lots of good doctors around here.
All right. I'll definitely check it out.
Take care now.
Thank you very much, Doctor.
You're welcome.
Well, and thank you there, Tom. And I've got waiting patiently Sarah, Sheila, and Tom again. Good morning, Sarah.
Good morning.
Hi.
I want to ask, you mentioned Ozempic, and I recently heard about the lawsuits about Ozempic and Wegovy causing a rare eye condition that causes blindness, and there's lawsuits starting.
Okay.
What do you know about this?
Lawyers are aggressive and they like money.
Okay. But
lawsuits are always going on about medication.
Well, does Ozempic cause blindness?
Maybe. I don't know. It may be one of the adverse consequences. I've not seen it in anybody that I've treated, but it's quite possible. Here, let's pull up the Ozempic adverse consequence page.
It's not listed. That's why I think people are suing. I have the name of the condition, non-arteritic anterior ischemic optic neuropathy.
Ah, okay. You know what? Many of the conditions that are associated with the inflammation that, let's see, has been associated with it. This is an AI overview. While the risk is considered low, it is a serious side effect. Yeah, all interventions have a risk-benefit ratio. The likelihood of having this occur is probably pretty darn low. But let's see, is any further information?
My question is it worth the risk to lose one's eyesight to lose weight?
Well, if the risk of losing your eyesight is 1 in a million and your likelihood of losing weight is 1 in 10, that risk-benefit ratio is probably pretty good. But I don't know enough about the condition, whether it's reversible or how frequent it occurs to actually really comment further. But yes, every intervention we do has adverse consequences, and we need to weigh that with our decision to do an intervention, such as I mentioned with the man with prostate cancer. Do the intervention that has the least adverse results first. So yes, if you need Ozempic, it may be worth the risk. I can't tell you that for you, though.
Okay, yeah. The article I'm looking at says generally, and I don't think this was the Ozempic Wegovy semaglutide or whatever population, but I think it said just generally in the United States population, NAION affects about 2.3 people per 100,000. So anyways, I just thought I'd ask about that because that's concerning me. I am on Ozempic and have been for about a year, and I thought about it this weekend and thought, I don't know if it's worth losing my eyesight for. So.
Well, are you having good success with the Ozempic?
Yeah, about 50 pounds.
Fantastic. So at some point you may want to consider going off the Ozempic and doing it naturally, because Ozempic is designed to help move your body into a different place. And my thought is you don't need to take it forever.
Right. Yeah. I was thinking the same thing, like give me a good push, a good start, and then switch over to
exactly
changing some of the other things I haven't had to change while taking Ozempic, but are better.
Now you have to change them. That's the fallacy. You should have been changing those all along.
I know.
Yeah, that's the key. There ain't no magic bullet. You got to do the work.
Yep. All right.
And I would suggest that the people that get the complications are the people that aren't doing the work. You're going to have a higher likelihood of an adverse complication if you're just trying to cover up your bad habits with a pill or a shot.
Yeah, but I don't know if I've talked to you about this before, but this is my issue. I heard you talking to the guy, the first caller, about the nut situation.
Yeah.
And I don't know, maybe you've talked about this before. I'm sure you have. I feel like my body is so addicted to sugar and processed foods. I can tell you just quickly, I recently bought a package of a new kind of candy. I'm not really a candy person, but I don't like chocolate, so I thought, I'd get away from chocolate. Let me try this thing, and it's a new flavor of a candy. It's a non-chocolate candy you can buy at your local convenience store. I could not stop eating those candies. And I thought, okay, so not JFK, RFK Jr.'s onto something here. There is something in this candy that is making me say, my brain say, or my body, brain-body combo, more.
Well, is there sugar in it?
I have tried getting off sugar many times in my life.
So in your candy, is there sugar?
Oh, of course, yeah.
Well, that's the substance.
Oh, no, there's something more than sugar, because I can stop sugar for short periods of time. I'm telling you, I couldn't stop shoveling these things in my mouth. Like, literally, I wanted more and more. But let me just
There's a good example
I've had success at one point in my life, probably about 10, 15 years ago. I did not eat sugar, white sugar, to my knowledge, for 12 months.
Okay.
That's the longest I was ever able to go. But once I started back and had that first sugar cookie, I've never been able to quit sugar again.
Yeah. So it sounds like you do have a relational issue with sugar, and maybe energy work, hypnotherapy, psychotherapy, or meditation could help you actually change your internal relationship with it. You can use meditation to actually change your opinion about how you think about sugar.
What medication?
DrJoeDispenza.com. He has all kinds of meditations where you use your consciousness to change how you relate with reality.
Okay. All right. Thank you.
Yes. Good luck, Sarah.
Thanks.
Thank you very much there, Sarah. Let's go to Sheila. Good morning, Sheila.
Hi.
Hi, Sheila.
Hello.
What do you have today for us?
First of all, I'd like to say that I went online and looked up that test you said you do in your office, and I think that's really fantastic, but I don't think I'm there yet.
You're talking about the NutriVal test?
Right, yeah.
Yeah.
I'm your best and worst patient. I'm a nurse, so I went and looked it up and gave it to some of my providers, but nobody was kind of interested, and I'm a little tapped out on doctors because I have a Chiari-like malformation that we found about 2 years ago. And I'm struggling because when I was 30, I had an encephalopathic stroke, and they didn't really know why. And they only could figure out that I was super sensitive to medications, and they didn't know why. And then about 3 years ago, my arm went numb, and now it's caused my neck to start herniating. So I have 4 herniated discs in my neck.
Wow.
Yes. So, and 2 bone spurs, and one is growing a slight scar mass. So I had a neurosurgeon, and he was great, and he said that he kind of wanted to put off any surgery unless, everybody says you look normal with 4 herniated discs, which is kind of a little bit of why I see a psychiatrist anyway. But I'm really struggling with prognosis of this. Like, what do I do? I've been referred up to USF because my neurosurgeon, unfortunately, dropped my insurance on me. So I'm really looking for, like, a kind of a good... I just really need to be pointed in the direction. I can do research unless there's something specific you have about Chiari-like or Chiari. I'm actually non-herniated. Mine's right at the foramen, but since it's caused the secondary issues, they call it Chiari-like or CM0, I guess is a new diagnosis they're talking about.
Does a neurosurgeon saying that your Chiari-like malformation caused the herniated discs?
Yes, it's highly likely, yes.
Oh, interesting.
So, because of the pressure variance, I guess it's kind of like a fight between the head and the neck to get things going. And I also have PCOS. So, like, I've gained weight since I've developed this cervical radiculopathy, you know, and I really struggled because when I run like I used to, the pressure in my head goes up. So I can't kind of keep up the cardio like I would like.
Yeah.
So
why did you say you had the stroke? What was the condition?
Well, I was a totally normal person, and I had a mild back injury, and I kind of popped it, and we didn't know if it was the slightly bulging disc or the.
But you used the word. You described it, didn't you?
The transient metabolic encephalopathy with alpha wave disturbances was the official term.
Metabolic encephalopathy. Okay, so you have something going on metabolically here behind all this.
Right. Well, that's kind of my problem. Is I've developed when I was 19, I was diagnosed with PCOS, and then when I was working at a hospital, they did a evaluation, and they called me into the office with the blood work, like something was wrong, you know. And they said, well, you don't have to worry about it, but your bilirubin is like one tick up. So they said, you know, it could be Gilbert's, it could be this, but you don't need to worry about it. You just need to get your LFTs checked every day. So when I had that transient metabolic encephalopathy, unfortunately, I had a first-year psychiatrist hyperdose me with the wrong antipsychotic.
Well, did they ever tell you why you had a metabolic encephalopathy?
Well, they think they didn't know, but now that they've found the malformation, kind of like you can't go backwards and you just have to.
Yeah, but the thing is, a metabolic encephalopathy is metabolism. A Chiari malformation is an anatomic thing. Yes. We're talking they're trying to conflate things here. I think you need a better neurosurgeon and maybe a functional medicine doctor to sort this stuff out. You keep layering on more and more complexity here that makes it quite impossible to tease it apart in 5 minutes.
Okay.
Really, it's like this is intensely complex. You have quite a challenge here with metabolism, potential anatomic issues. This is, and you definitely have the PCOS, which is a metabolic issue. So there's so many layers here. I'm not sure how you'd ever dig this one out without a long-term look and consultation.
Right. Well, I mean, that's what I kind of feel like. My physicians are great, but I'm down in Manatee County, which I don't know if politics there, the county doesn't want to help the hospitals pay for indigents, and it's kind of like, well, if you don't even want to pay for the poor people, how can we ever find a middle ground?
Yeah, it was terrible when Manatee County sold that hospital. They had a public hospital there, and they sold it to private interests. They got rid of that hospital, unfortunately. Everything, they have to privatize everything. Sarasota's public hospital is a shining star. Manatee could have had one.
Right, I agree.
I used to live in Manatee County. Very distressed with those people.
So, I mean, like I gave your test to my providers. So like I said, I have really great providers, but like you said, this is kind of like really complex. Like I have PCOS, and there's a lot of metabolic things, but is it because my body is trying to overcome that malformation? You know, like what is causing?
That's a good question, and nothing we're going to answer here, unfortunately. There's too many layers to this.
Okay.
So thank you for your very complex presentation. But yeah, you need a real consultation, I think, my dear.
Well, I do have a referral to go up to USF, and my primary said that he thought it would be good for me to get plugged in to USF neurosurgery.
Yeah.
Because it is complex. So I do have that referral, and I
think you need somebody outside of neurosurgery. You have metabolic issues, so you need a metabolic doctor.
Well,
that's the key.
What I was kind of calling about is, like, do you think it's worth, like, maybe coming to you or someone who does your test? Because my providers are like, yeah, that's really interesting, but it's, like, not something they want to add on or tackle.
I really think you need somebody who's not a standard Western medical doctor who only looks at illness. You need somebody who looks at the whole big picture, and they don't.
Okay. Right. So do you have a recommendation?
Yeah, ifm.org. Do a physician search in your area, the closest you are.
Okay.
Or you can go to Functional Medicine Florida or email info@functionalmedicineflorida.
Okay.
All right, my dear?
All right, thank you.
I'd love to help. Have a great day.
All right. You too. Bye.
Well, we're hopping here like a bug on a hot sidewalk. I've got 5 callers and 10 minutes left to go, so let's hop right on into Tom, who's definitely setting a record for patience. Good morning, Tom.
Hey, good morning.
Hey there.
I enjoy your show. Thanks for doing
Thank
it.
you.
Since you had a discussion on testosterone earlier.
Yes.
And I'd like your opinion on, I take Clomid, 50 milligram tab, 3 half tabs a week for keeping testosterone levels up. What's your thoughts on that?
Well, Clomid does tell your testicles to work. The question is, what was your testosterone before you were on Clomid?
I think it dropped below 200.
Oh, okay. And now you're staying above that?
Yeah, I'm up in the upper 400s.
Well, that's a way, you're actually helping your testicles do their job. Rather than taking testosterone exogenously and suppressing your testicles, you're actually using a medication that helps the testicles make more testosterone. So I like your approach. If it's keeping you in that range with only 3 half tabs a week, you're doing pretty well.
Yeah, the doctor said, after a while, your body's going to kind of get used to it, and we're going to have to up the dosage. But it's been, he said probably after a year, but I've been on it over 2 years, and I'm still, at that level. And
that's excellent. So what kind of a doctor? Is it a urologist or primary?
Yes,
urologist. Okay, yeah, I haven't heard any primaries or functional doctors using that approach. That's usually urology, so that's good. Glad you got success.
Okay. Well, I appreciate your feedback. Thank you.
Anytime. Have a great one.
You too. Bye-bye.
Thank you there, Tom. And let's go to Patrick in St. Pete. Good morning, Patrick.
Good morning, all. How are you doing today?
Fantastic. Patrick, how are you?
I'm above ground.
That's a good place.
Yeah. Here's my situation. I had a AFib attack almost 2 years ago, and I woke up in the hospital after 9 days to a shocking experience.
Wow.
I do have I have a defibrillator placed in my heart now, and I'm down to 7 medicines. I was wondering if there's anything I could do naturally to handle this situation.
Well, at this point, hard to tell. That was 2 years ago. Things have changed. Did they ever treat the reason for your atrial fibrillation, your sleep apnea?
Nope, they did not.
For sleep apnea?
Yes, and I am a bit overweight.
You have been checked for sleep apnea?
No, I haven't.
Oh, you haven't? Yeah, I would get checked for sleep apnea. Alcohol and sleep apnea are the 2 principal causes for atrial fibrillation. And so if you aren't an alcoholic, then it's likely you have sleep apnea. And if you're a little overweight, it is a cause for it. Treat it, and overall your body will get better.
Fantastic. Fantastic. I'm doing aerobics and all this stuff. I have some experience with natural herbs, but I've been advised not to take those by a cardiologist.
Yeah, they don't know much about that stuff because they don't know what interacts with what. You're on 7 medicines, so they interact with stuff. And those 7 medicines you're on, no one's ever studied them together in one human body to see what adverse consequences do occur. So you're an experiment walking.
You got that right. Thank you very much, Doctor.
You're welcome, Patrick. Have a great day.
You too.
And let's go to Jenny in Tampa. Good morning to you, Jenny.
Hi, how are y'all?
Fantastic. How are you, Jenny?
I'm okay, and I have 2 questions for you, Doctor. I have a friend who won't take, he doesn't like to take supplements, so he's been eating liver to get B12. I have tried to convince him that liver is probably not the best thing to eat these days because it sort of, cleans out the toxins in the body. So that's a question. The other question is also I eat salmon several times a month, and this friend also will not eat salmon because he's convinced it's a big fish and it gets too much mercury. So what can you tell me about those 2 things?
All right. So B12 is a great, liver is a great source for B12. If you're going to eat liver, I would actually look for grass-finished beef, local herds. Some of them are doing grass finishing. Organic. Excuse me, organic beef would be the other thing or organic chickens. So I have no problem with eating liver. I think organ meat is fine, but just eat clean organ meat. And
that was my suggestion too. Is that you don't want to eat just an ordinary common liver off the feedlot.
Yeah, and then salmon. King salmon is a big fish. I tend to avoid king, and I go for sockeye or chinook or something like that. Usually, I get some smoked sockeye. That seems to be the one that shows up in the store that way. But wild caught is available in cans, and it's relatively inexpensive. And salmon is one of the lower in mercury fish. So yes, avoid the big mercury-containing fish: swordfish, shark, tuna, king mackerel. But salmon's great. Your friend is confused.
Well, swordfish we shouldn't be eating anyway. The big billfish are all endangered.
Yes. Agreed.
All right.
You can go to Environmental Working Group.
Have a good day.
You too. If you go to Environmental Working Group, you get a list of the safe fish. And you can also Google, if you're in Florida, Safe Fish Florida. The Florida Wildlife Commission puts out a report on how much mercury is in the fish in Florida. So you have some good resources out there.
Okay. Thank you.
Mm-hmm.
Thank you there, Jenna. And I do believe we've just got a few more seconds. Let's go to Ruta in Tampa.
Hi.
Hello, Ruta.
This is Ruth, and I appreciate your program. My question is, I just heard about the vagus nerve stimulator. It's a stroke recovery possibility. And
yes.
I wanted to know, when I woke up from surgery with my right hip replacement, I was paralyzed on the left side of my body. That was 5 years ago, in June 2020. And now I have no feeling still on the left side of my body. And I'm wondering if the vagus nerve stimulator might bring back the feeling in the left side so I can use my left hand and actually feel what I'm carrying.
So vagus nerve stimulators don't do that because the vagus nerve doesn't run your arms and legs. There are other things that can help with stroke recovery, but the vagus nerve stimulator is not one of them.
Okay, so that won't be any improvement.
Well, it's not associated with that kind of treatment. So no, it probably won't change your weakness. There are other things you could do. I would actually look for a good neurologist locally and see if you can get some better information.
Okay, because the internet said that it improves the strength in the affected side of the body. So they did it most with the arm, and they said it'll make your arm a lot stronger. But
well, I wouldn't invest in that without first talking with a good neurologist.
Thank you.
You're very welcome. Looks like we are down to the end of the line here, and I have, a minute left, if that. Just to follow up on something previously, Mike says, can I speak about ablation for atrial fibrillation? Yes, ablation is where they actually use an electrode and fry the conduction in there, and it does stop it. It is a treatment for it. It's very effective. Not everybody needs it, but get your sleep apnea checked first. Hey, I want to thank everybody for a great interactive show. Bill, you did a wonderful job again, as usual. And Sarah is on the phones today. Thank you, Sarah, for answering. And thank you, all my listeners, for wonderful interaction. Sorry I didn't get to more emails today, but wow, the calls were very good and very complex. Thanks again, and I'll see you next week for some more Ask Me Anything.
Well, we're looking forward to next week, but you did a great job today. And yes, it was sort of a full board pop quiz for you. So I'm very impressed. And I do want to thank all those folks that called and everyone who listened, and give a special shout out again to Sarah. We could not have done the show without her. So to everybody on out there, take care and stay healthy. You have been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Coming on up is 5 minutes of NPR News, and then strap in and get ready for the Sustainable Living Show, hosted by the legendary guest host, John Butts. So, until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.